Thank you very much for joining us. We are live from Zimbabwe International Trade Fair 2021, and this is our first day here at Zimbabwe International Trade Fair. Thank you very much for joining us on various social media platforms, especially SlyMedia Productions and National AIDS Council. And today, to take us through what National AIDS Council has been doing for the last 20 years is Trust Govero from the National AIDS Council Communications Department. Over to you, Trust.
Thank you. Welcome to the National AIDS Council stand. This year we are exhibiting at the Zimbabwe International Trade Fair as National AIDS Council under the theme showcasing the new normal for business and industry, realities and opportunity. So for National AIDS Council, we are going to exhibit and showcase our achievements which we have done over the year. And we are going to exhibit under different thematic areas so that we highlight our achievements and progress which we have made over the year. So to start with, one of our functions is to do resource mobilization and to showcase what we've done under resource mobilization. We have there a picture to illustrate one of the activities which we have done for resource mobilization. As National AIDS Council, we have been doing fundraising activities, especially using golf, and these proceeds have gone to the cancer prevention and management. So to date we have managed to procure cancer screening machines under the resource mobilization initiative of National AIDS Council, which is being done through the golf tournament, which is done yearly for men and women. Also, the other function which we do as the National AIDS Council, and which we are proud to exhibit at this year's show, is that we are heavily and deeply involved in strategic information flow. We would argue that media have played a very big role in terms of informing the public and demystifying myths and misconceptions around HIV and AIDS. So as National AIDS Council, one of our functions has been to capacitate the media with the current and emerging HIV and AIDS issues. This one we've done through it, capacity building meetings, and we have rewarded the journalists who have been outstanding, and also media houses who have been outstanding in HIV and AIDS information flow. Last year we had a COVID pandemic which hit the whole world. As National AIDS Council, we were not left behind in terms of managing the prevention of COVID-19, as it was also affecting people living with HIV. So we have done a lot of work within that area. We have assisted uniformed forces with PPE, and we have also assisted Ministry of Health and Child Care with PPE so that they carry out their job efficiently and effectively in a manner which is conducive for them to prevent and manage COVID. So we'll also take you through our stand so that you can also see what's inside. This was just an overview of what we are going to be showcasing inside the pavilion. Okay, so now we are entering the National AIDS Council pavilion. Inside our pavilion, we are going to be highlighting the achievements which we have made over the past 20 years. So with us today, we are going to start. One of the functions of National AIDS Council is to do health systems strengthening. In terms of health systems strengthening, we've done it in various ways. Just to highlight what we've done, with the support from Zimbabwe Informed Forces and working with the Zimbabwe Informed Forces, as the National AIDS Council, we provided resources for the construction of Chingwizi Clinic. The aim was to make health services available to the community so that they can access HIV and AIDS services within their communities. So to highlight that function, that is the Chingwizi Clinic, which was constructed and handed over by the then Minister of Health and Child Care, Dr. Parenyatwa, Senator. So to summarize also what I've been talking about, I'll just give you a glimpse of the functions of National AIDS Council as I take you through. So this is our vision as National AIDS Council, we hope that by the year 2030, we'll be having a Zimbabwe which is free from HIV new infections. And to achieve that, our mission is to lead, coordinate the national multi-sectoral response to HIV and AIDS. So, in order to achieve our vision of free HIV new infections, where there's no stigma, where there are no related HIV and AIDS deaths, we are going to do it through the mandate of providing measures to combat the spread of HIV and management. And over the 20 years, or over the past 20 years, the major achievements which Zimbabwe has made is to reduce the HIV new infections and the prevalence. So, as a country, right now, our prevalence is at 12.9%, meaning for every 100 people we see, 11 of them are HIV positive, and our incidence has dropped to 0.27% over the years, which is a very big achievement from around the year 1990s, where the HIV prevalence was hovering around 29% and the incidence was well above 2%. And as well, Zimbabwe, as part of the global community, we also have achieved, or we were part of the efforts to achieve the 1990 targets. So I'm going to highlight the achievements which we have made under the 1990 targets. The 1990 targets, basically, they are there to ensure that 90% of people living with HIV should know their status, and of the 90% who have known their status, they should be put on treatment, and of the 90% who have been put on treatment, they should have their viral load suppressed. So as a country, we are very happy that we have surpassed those targets. And as we report, by 2021, we had 95% of people living with HIV knowing their status. And of the 95% of the people living with HIV knowing their status, 99% of them had been put on treatment. And those 99% who had been put on treatment, 90% have had their viral load suppressed, which will really assist us in terms of achieving ending AIDS by 2030. Meaning by 2030, as a country, we hope that HIV and AIDS will no longer be a public health threat. So I'll also take you through one of our mandate. Our core mandate as National AIDS Council is to provide treatment to people living with HIV. The treatment which we provide for people living with HIV is free of charge and can be accessed by anyone throughout the country, so that they have affordable and access to the treatment. So to showcase what we've been doing in terms of treatment, this is a picture to highlight the handover of ARVs to Ministry of Health and Child Care. As a council, what we do is we provide funding for the procurement of antiretroviral therapy, drugs or medicines, which will be put into public health facilities where people can access this treatment free of charge and for life. Then, as National AIDS Council, I've highlighted it again, that globally, over the past 1 to 2 years, we were hit by the COVID-19 pandemic, which also, as a council, it also affects people living with HIV. So as a council, we've been spearheading and also being part of the multi-sectoral response to COVID-19 prevention by providing PPE to uniformed forces, by providing PPE to Ministry of Health and Child Care, so that the public can access it. And to take you through again, as a council, we are also involved in ensuring that there is safe blood transfusion. As you are aware, that some of the new infections of HIV are attributed to blood transfusion. So as a council, we make sure that, or we ensure that we have safe blood transfusion. So over the years, we have been supporting financially the National Blood Transfusion Services with funding to buy those commodities which ensure safe blood transfusion. And also, in terms of HIV prevention, we also ensure that we have access to quality HIV prevention methods. For example, the condom use. Condom use is one of the major HIV prevention strategies. So as a council, we would also want to ensure that people have access to safe prevention methods. So we also support and ensure that we have enough condom testing machines within the related institutions. So I'll also take you through the other function of National AIDS Council. The other function of National AIDS Council is care and support. We know that we have people living with HIV who have passed on, or people who passed on due to HIV and AIDS, and they left their orphans. These orphans have become vulnerable such that they will be finding it difficult to have resources to access education facilities. So as a council, we contribute to the BEAM initiative over the years, every year. So this is a handover of a BEAM check to the Ministry of Health and Child Care, which is being handed over by the then body chair at that time for onward transmission to the related ministry, which is Ministry of Education. So basically that was an overview of National AIDS Council. And on the prevention side, we have, as a council, we are now concentrating or putting more resources in preventing HIV new infections, as we are aware that prevention is better than treatment. So we have models which we are conducting, which are targeting specific populations where we have seen that these populations are at risk of contracting HIV. So these models will not target the general population, but will target specific populations who are at risk of contracting HIV. So the first model which we have is the SASA model, which mainly concentrates on community mobilization to end violence against women and girls. We know that gender-based violence contributes to HIV new infections by disempowering women and girls to access HIV and AIDS service. So this model will basically target that population. Within that model, for example, there's a dignity pack which consists, one of them is sanitary wear for our girls and young women so that they don't become vulnerable to abuse. The other model which we are conducting as the National AIDS Council is the CATS model, which is the Community Adolescence Treatment and Support. This model is spearheaded by community adolescent treatment supporters who are living with HIV. Basically, their function will be to ensure that there's provision of integrated clinic and community HIV and AIDS-based services for children. Then we also have a model as National AIDS Council, which is DREAMS, which basically means, it's an abbreviation to mean determined, resilient, empowered, AIDS-free, mentored, and safe. This model targets girls and young women, and it empowers them by providing educational and life skills. Then we have another program model, which is peer-led. What we have discovered as National AIDS Council is that usually people listen to their peers when they are talking. So we capacitate peer educators so that they can disseminate HIV and AIDS information within or among their peers. Then we have the sister-to-sister program, which is a program mainly empowering young women and girls so that they utilize integrated sexual reproductive health and sexual gender-based violence services. Not to be left out, I think the models which we have highlighted mainly targets women. So we have another one which targets boys, which is brother to brother. So it's a program which mentors adolescent boys and young women in terms of capacitating them with HIV and AIDS life skills. Then we have the issue of key populations. Key populations are those groups of people who are at increased risk of contracting HIV. So we have different programs for them which target them and which suit them specifically so that they are not put in the generalized community response. So those were the models which National AIDS Council are conducting. Then another function of National AIDS Council is community health systems strengthening. What we have done as National AIDS Council, we have our community health workers so that people access HIV and AIDS information and services within their community. So we have been capacitating these community health workers by giving them information, by giving them equipment so that they can carry out their roles and duties. This picture illustrates that as National AIDS Council, we've bought bicycles for them for easy transport and movement within their communities. So I'll then summarize our exhibition by taking you out where we are exhibiting as National AIDS Council together with our partners. So we are going to move from one partner to another. We usually exhibit with a lot of partners, but because of the COVID-19 pandemic, we have limited the partners who are participating. So this year we have partners who are into cancer, we have partners who are providing HIV and AIDS services, we have the Young People's Network. So I'll take you through the partners and they'll highlight what they are offering at this year's exhibition. So, to start with, we are going to come to one of our major partners, which are Kids Can Zimbabwe. Kids Can Zimbabwe is an organization which focuses on cancer services for children and the other target audience. So to unpack that, we have the Kids Can Zimbabwe official who is going to take us through what they are offering and what is their organization about.
Okay, thank you very much, Trust, and good afternoon to you all. Welcome to our stand at the Trade Fair 2021. We are here as Kids Can Zimbabwe to showcase and talk about childhood cancer in children. You know, it is a silent topic, but we know our children are suffering from cancer. So we are here to share with the public and also give them information to come right. So here we've displayed the types of cancers that we have that are really common in Zimbabwe on the chart of the wall. And we talk about cancer of the eye, which is one of the top cancers for children and attacks children between the ages of 3 to 85. And then we also have cancer of kidney, again attacking children who are much younger, from the age of 0 to about the age of 9 or the age of 5. And also information on leukemia, which is a blood cancer, which attacks again children from the ages of 3 up to the age of 18. Then we're talking of children. So here at International Trade Fair this year, 2021, we are saying children have got cancer, do get cancer. Now through our hands, we can actually improve the survival rate of children. Why are we saying through our hands? Children need us to look, for us to look after them, because we as guardians and parents are the ones who can actually notice that there's something wrong with the child. Now through you, a parent or a guardian, you can now take a child to be seen by a doctor and a diagnosis is made, and then treatment can also be initiated. So we will be giving out pamphlets with that information. And then secondly, we also want to tell the public that this September, we are celebrating childhood cancer. We call it Childhood Awareness Month, where we wear the gold ribbon. So we should all go gold, because our children are resilient, our children are precious, just as much as gold is precious, and also our children are also precious. So wear a gold ribbon, just symbolizing childhood cancer. So on our table, we've got the information pamphlet, and these information pamphlets will tell us who Kids Can is in one of them, and our contact details. And the other pamphlets are going to tell us about the types of cancers you can read about in children. So they're all here on these pamphlets. So you need to come through, pick one, or come to our offices, pick one, so that you can read that information, which is very informative. We also, we have children who lose their hair due to chemotherapy. And here we actually are saying, because our children are losing hair, so we're using, bandanas. I know bandanas are used in the West by the cowboys, but here in Zim we are saying with our children, because they're losing hair, these they will tie around their head to hide the bald head, which would have taken place. But remember, after chemotherapy, the hair will come out even better and much, much, much stronger. And just to end it all, we want to celebrate our children. We want to make sure children are looked after. Please look out for these cancers I've talked about and other cancers that we didn't even mention, but they're all on the pamphlets. And when children are sick, bring them for early detection, because early detection can actually save a life. Thank you.
So we are going to take you to the other stand. So we have Kids Can. We have explained what they are doing at our National AIDS Council stand. So we also have a major partner who is AHF. Our partner AHF have been into HIV and AIDS over the years. So with us today we have an AHF official who is going to take us through what they are doing as AHF and what their organization is about. So I leave it to you to take us through.
All right, good day. My name is Patricia Spanda. I'm the Prevention Program Officer for AIDS Healthcare Foundation, Zimbabwe. We are an organization that works with the Ministry of Health and Childcare, where we are into HIV programming. Mainly the services that we offer, they are prevention, care and support, whereby we are saying by 2025 we need to have taken the HIV under epidemiological control. Under the prevention component, we have the condoms. We are distributing male and female condoms for the prevention component. And we are also giving out health education. We are doing the condom demonstration. As an organization, we pride that we have introduced into the public sector our brand of condoms called The Love. And we've also got the icon. The Love is a small to medium fit, and then the icon is a large diameter kind of condom, because we discovered that one size doesn't fit all, and the other thing, it's a bit slim, so most people prefer it. And we also have the blue and gold, which is the new kid on the block. This is the condom that I'm talking about. It has since been rebranded. Maybe people used to know it as Panther, but now we've got something that has been rebranded. It's called the Panther. And then, like what I was saying, that we do care, support. So for our clients at our centers of excellence, because what we have done when we came to Zimbabwe, we changed the infrastructure, the human resources for public sectors, and we termed those institutions the centers of excellence, because initially Mpilo was called Mpilo OI, but we felt that it was a bit discriminatory, so we changed the name to Mpilo Center of Excellence, and we've got those centers of excellence not only in Bulawayo, but we have in Harare. We are also in Manicaland. We have expanded to Gweru. I think next year we might be expanding to Mad South and Masvingo, whereby we are having the centers of excellence. So at the centers of excellence, we've got clients who are already positive. So for the young ones, the 10 to 24 years, we support them with the sanitary wear. There is the disposable and the reusable pads that we are supporting them with. So today this is what we have under this tent. So maybe we can proceed and I take you through to the other tents. Here is just where we are, is our reception, and we are giving out information under that. And here we've got, all right, here we've got people who are carrying out the HIV testing, the procedure. She's Nomalanga Stole, she's Zinzile Spanda. What we are doing here, we are doing the self-test and the blood-based test. So like what the new guidelines that we are using, they are saying that we should do the targeted testing. So what we are actually doing, we are first of all using the self-test as a screening tool for those who are at low risk, and for those probably who are at high risk and under the prevention of mother-to-child transmission, we are using the blood test. So maybe we can proceed that side. We have got a mobile clinic, the state-of-the-art vehicle that is going to be carrying out outreaches in the suburb Country Park after this ZITF. So we've got a clinic where we're doing the cervical cancer screening and the breast cancer screening. So maybe we can, all right. So basically we are doing the procedures here on the ground because we are actually integrating the services, HIV and integration of services. So like there is the cervical cancer screening. They are also carrying out the breast examination. She's actually doing what the procedures which is called VIAG, whereby they are visualizing the uterus to check for the precancerous. There are stages, there are about 4 stages, the precancerous, then the stage 1, the stage 2, and the stage 4. Here mainly is visualization. And then here we've got a clinic. We've got a sister who is actually doing the distribution of art. There are refills. Maybe you have come to the trade fair and probably you have not come with your medication. We can refill for you here. And then we've got a lab. Like these days what we are saying is HIV test and treat. So what we are actually doing, we are initiating people on art here at ZITF. So what we need to do, let's say for someone who has tested positive, what we do, we have to do the baseline lab test, the CD4 count. If the CD4 count is less than 200, automatically we have to screen for TB and meningitis so that we rule out the advanced HIV. And then the other thing, we are also initiating people on TB prevention. These days we are saying TB and HIV, there is a TB is a co-infection of HIV. So we are trying to prevent our people who are living with HIV from having TB. So we are actually initiating them here on TB. And then the other thing, we are also doing the retention. So maybe the retention, how we monitor retention, we do the viral load monitoring. So we are actually doing this on the ground because maybe some people are always busy and they don't get time maybe to go to the labs or to their facilities for this test. So we've actually brought this service here so that maybe we can help, especially those who are working. And then this is our reception area where we are actually registering our clients for the self-test. And we actually also doing the BPs, and we are also checking the weight so that we can rule out the non-communicable diseases as well. So generally, maybe in a nutshell, this is what AHF is offering today and for the rest of the trade fair. Thank you.
Okay, thank you, Ms. Manda, for taking us through what AHF is doing at the Zimbabwe International Trade Fair. We are very happy that we are offering services to the public. But we are also very lucky that we have one of the person who have access to your service. So he just wants to share a few words with the general people of his feeling and what he has accessed at the Zimbabwe International Trade Fair HF stand. Thank you.
Hello viewers, I'm here at the Hiv 2021. I have been here just to test for HIV at the Zimbabwe National AIDS Council. Yeah, it's kind of scary, it's kind of awkward, but I had to do it, and it's good to know your status. All I can say is just test, know your status, just do it for you. That's all I can say.
Okay, thank you. This is that was one of the clients who had visited us at our stand, telling us about his experience. So we also have a very special subpopulation within the HIV and AIDS response, who are the young people. We know that the young people are exposed to HIV new infections. So we are also doing something for them at the Zimbabwe International Trade Fair NAC stand. So the young people, they will be interacting with their peers. So with us, we have a young guy, one of the young people who will be participating or who will be interacting with other young people. So the guy who tell us or will take us through is just a young man. You take us through the young people's stand. It's the Young People's Network. So in brief, you tell us what is about the Young People's Network, what they do, and what they are offering at the Zimbabwe International Trade Fair. The young people are a very important subpopulation in terms of HIV national response. Thank you. I'll hand over you to Mr. Hlahla, to take us through the stand.
All right, good afternoon, and thank you very much, Mr. Trust. I appreciate you for coming through. My name is Samola. I am a member of the Young People's Network on Sexual and Reproductive Health, HIV and AIDS. So the Young People's Network on Sexual and Reproductive Health, HIV and AIDS, which can be a mouthful, or preferably YPNSRHHA, is a network of young people between the ages of 10 to 24 years that is convened by the National AIDS Council of Zimbabwe with support from UN agencies as well as the Ministry of Youth and the Zimbabwe Youth Council. So this network has a very strong mandate of informing and coordinating and leading the national response when it comes to the youth response to sexual reproductive health as well as HIV and AIDS. I'm pretty sure you have heard of the HIV prevalence a bit earlier on and how concerning it is, but we are very much concerned as young people and want to push to make sure that our prevalence goes even further down. And so to do that, we are here at the ZITF engaging with young people, not just young people, but we are engaging even with the parents, we're engaging with the caregivers, we're engaging with the different stakeholders that are involved in the growth and the upbringing of a young person. So behind me, we have some of the flyers and posters that we're going to be sharing the messages that we are pushing for this particular juncture in terms of the period of the ZITF 2021. And so you will see we first have what I have just spoken about in terms of who we are as a network, in terms of our mandate. I will speak as well in terms of our membership, which is very broad because it covers all the 85 National AIDS Council districts in the country. So we are there in each and every district. We are there in each and every province. Our sectors are very broad and very wide. They include young people in school, young people out of school, young people in tertiary institutions, youth with disabilities, and very broad, youth in mining, youth in agriculture, and so on. The reason why we have so many of these sectors is because we are trying to make sure that no young person is left behind in the national sexual and reproductive health as well as HIV response. The message that we are pushing for this particular ZITF is what we have termed our very own stylish ABC strategy. This is a strategy that we are using to make sure that we are young people are driven towards living very safe lives. So our alphabet starts with A, which is trying to make sure that young people pursue abstinence, knowing, of course, we have primary abstinence and secondary abstinence. So we're encouraging that young people, if you have not had sex, and we connect that with our D, you must delay the onset of sex until you have achieved your goals in life. Saying that our secondary abstinence speaks to the fact that if you have had sexual interactions before, you can still make an informed choice to stop and pursue other goals in your life. Our B speaking to being faithful to one faithful partner as a way of reducing any sort of transmissions around HIV and STIs. We talk about correct and consistent use of condoms. We are saying that our young people must not choose any point in time when they want to use a condom, but they should make sure that for every sexual encounter that they are going to have, they must use a condom correctly and consistently. By correctly, we mean that we are also going to be sharing with young people as well as parents and caregivers how to actually to use a condom properly, all the steps that are involved when it comes to using a condom. We talk about early treatment of STIs, and a very important one, which I think even our parents will appreciate, free and frank discussion on HIV, SRH, as well as HIV and AIDS. We don't want our young people to be informed by their friends or by other sources, especially the ones that are rampant in this age on the internet, that are misinforming young people. But we want our parents to be equipped and engaged so that they can, at the end of the day, have these conversations with the young people, either at home, be it in the church, or any social institution that our young people find themselves in. We talk about getting tested for HIV and young people knowing their status. Medical, male circumcision, very important, especially for adolescent boys and young men. But there are also still benefits for adolescent girls and young women when we talk about cervical cancer. We are going to be talking about pre-exposure prophylaxis, which are some of the services that are being provided by our partner here, AHF, and as well as post-exposure prophylaxis, especially for those young people that find themselves at high risk of HIV infection. We talk about prevention of mother-to-child transmission for the young people that find themselves pregnant. They should then make sure that they take the necessary steps to protect not only themselves but also to protect their fetuses from getting HIV transmitted to them. We talk about treatment as prevention, especially when we focus on our young people that are living with HIV. That if a young person takes their medication, they are very consistent. What happens then is that the viral load is reduced. And once the viral load is reduced so much that HIV becomes untransmissible to the next person, we will slowly move towards achieving an AIDS-free generation. So much that we talk about. We talk about young people reducing even the spread of COVID-19. The advent of the pandemic has brought so many challenges to young people. We're not just talking about the COVID-19 as a pandemic in itself, but we're talking about some of the things that have resulted as a result of the pandemic, like talk about gender-based violence, talk about young people failing to access sexual and reproductive health services. So our push is that we want to amplify our voices around sensitizing young people about the dangers of COVID-19, about how they can prevent COVID-19, and how even if they've been infected by COVID-19, how do they then manage afterwards? Talk about them isolating, them making sure that they access health services on time so that the pandemic does not spread. We also talk about young people and their interactions online. I think the advent of COVID-19 has amplified so much the presence of young people and the interactions that we have online. But we are coming through and saying, young people, there is so much to life than just sharing information that might compromise even your privacy, or even cyberbullying. We talk about how young people must interact as they meet people online, because so many people have been taken advantage of online through either sharing passwords or sharing pins and so on. And some sexual predators are even out there to take advantage of young people who lack a lot of this information. We are here to amplify those messages to make sure that our young people are protected. We speak as well about some of the trending issues that we have in Zimbabwe right now that become sort of drivers to new HIV infections as well as new STI infections and other adverse sexual and reproductive health outcomes. We talk about drug and substance abuse, and we speak mostly about how drug and substance abuse has a very negative effect to the mental health of young people, and how it leads to young people failing to make informed decisions on their SRH as well as HIV and AIDS. So we are encouraging young people at this ZITF that abstain from abusing drugs and alcohol. That will help you to be able to have a clear mind to make informed decisions about your sexual and reproductive health. As well on our social media, you can find us engaging about all these different topics. We are found on Twitter at YPM Zimbabwe. We can talk there. You can even join some of our spaces where we share the different information that we have. And we can engage as well on Facebook at the Young People's Network, Get Engaged page. We share a lot of information to make sure that we increase the knowledge around sexual and reproductive health as well as HIV and AIDS amongst young people. You can follow us on Instagram. We are there in the spaces where a lot of young people are found to correct some of the myths and misconceptions around sexual and reproductive health, as well as to amplify the messages around prevention as well as mitigation of different sexual and reproductive health diseases. Finally, I will share with you around the message that we are preaching at this ZITF around stigma and discrimination. Our outcry to young people, our outcry to people in the communities is that let's stop stigma, let's stop discrimination, particularly of people who are living with HIV. And we have always said that young people must know their status. It's very important, especially to contribute towards the 90 that was shared by Trust a bit earlier. We want young people to know their HIV status. You are inviting people to understand and visit noncommercial. They can access care and they can access support. And if they are negative, they can still go on to preserve that particular status by engaging in safe sexual practices. We talk about adherence to treatment for young people that then test positive, to make sure that, as I stated a bit earlier on about treatment and prevention, we want young people to take their medication religiously such that their viral loads are suppressed and they reduce the chances of transmitting HIV to the next person. And us stopping stigma and discrimination as a community, as a country, will lead to these young people living a life that of an increased self-esteem. And the result of that is that young people will feel very comfortable to prevent HIV infection and reinfection in the different sexual interactions that they have. They will lead very healthy relationships that are very open and comprise of open communication. We talk about the healthy lifestyles that they are going to live, because they live in a society that understands their health needs and is well equipped to respond to any adverse situation that they might find themselves in. And at the end of the day, we want our young people to experience love, companionships, as well as positive living. That's just about what the young people are doing at the ZITF, and we invite everyone to come through, find out for yourselves, ask the necessary questions that you have, probably about that thing that you did not understand over time, or about that service that you think you don't have adequate understanding about. Come through. We have a very, very youth-friendly team that's going to entertain you and also respond to your issues in a very, very, very youth-friendly way. I think that's just about that. Thank you very much. I'll hand you back over to Trust.
Okay, thank you for following us as National AIDS Council on our page. The youth stand brought us to the end of our exhibition. So what we have taken you through is what will be exhibited and offered at the National AIDS Council stand. So we are inviting people to visit our stand this Tuesday, tomorrow Wednesday, then Thursday, and lastly on Friday. So what I'm telling the public and encouraging them is that the services which we have explained and which they have seen are also what National AIDS Council is doing on a daily-to-daily basis. So if you miss ZITF or if you miss Zimbabwe International Trade Fair, please visit our offices in all the provinces, in all the districts. You can still access the same information. And for those who also have missed the Zimbabwe International Trade Fair, there is also a Harare Agricultural Show which is coming in the next week. You can catch us up there for the other services. And in case you miss us in all those events, please visit our Facebook page, our Twitter handle, our website for more information about what